Hi, I am Dr. Aksu. In this video, I will talk about some facts on getting taller by lengthening surgery. Dreaming about being tall is a common cheerful inspiration for many people, and there is a statistical basis for that. Data from a well-being index study found taller people were more satisfied with their lives, more likely to report positive emotions like enjoyment and happiness, and less likely to report emotions like anger, sadness, and stress. On average, men who gave their lives the worst possible rating were more than 3/4 of an inch shorter than the average man. As the technology advanced, getting taller cosmetically was not an easy one, and it was even considered unethical. But this kind of surgery has been made much easier and sharper in recent years, so that people would not have to stick to their predefined body limits and perceptions. Being tall, of course, is also a kind of communication and experience of life, so it becomes accepted more and more as a life-changing, satisfying surgery for the very better way. While talking about having this kind of surgery, one must know the exact phases that will be happening. The end result will be very satisfying, yet the road to that should be tailored meticulously. The road to lengthening has been explained by my dear colleague Dr. Bilgili in the attached videos. Here I would like to inform you that many people have some inherent rotational or angular variations at their bones and live with that as if it is normal. But this kind of rotational variations are actually the cause of wear and arthritis of different magnitude that will emerge later in their lives. So there may be abnormal margins of angular or rotational differences of your bones that go unnoticed for decades. It will be evident as pain develops on their knees at some day at their 30s during climbing stairs or squats of some kind. So there begins the arthritis. This kind of inherent variations should be worked out preoperatively to understand the exact inherent nature of the lower extremities. I'm saying that the major concern on our part will not be the lengthening only, but the overlooked angular and rotational changes. And also, it is very possible to create a new angular disturbance if the surgery is not planned well. These angular rotational differences, whether inherent or iatrogenically created, as a minor complication, if goes unnoticed, will have adverse effects on the joints years later. It is absolutely possible to avoid these minor, easy to neglect angular disturbances that will cause wearing of joints. I'm not to scare you on lengthening, but to give you an insight as what is of importance. So the rotational and angular differences should be taken into consideration before surgery. And hey, it is very helpful to understand what is to be expected and if there's a risk of arthritis during your elderly life. So considering to correct not only shortness, but also minor or major angular or rotational variations as early as possible will give an immense opportunity to avoid possible joint wear and arthritis. Some kneecap anomalies can also be recognized and can be corrected early on before the suffering knee pains on flexions that will commence at late 30s. We do not only consider the lengthening issues but also the weight-bearing system of your lower extremity. So please expect a thorough examination from the tip of the toes to the backbone to make sure everything will be fine and smooth. In short, our secondary and as important concern is to correct some inherent angular or rotational conditions if present along with your lengthening procedure. We check the structure of the legs in every aspect before your lengthening. Thanks for watching. You may find further information on our website. Bye.